Hi, my name is Joanna Omatade, and for this case study, our topic was obsessity and rural behaviors. Topic, my first slide is health problems. So, an overview of our topic is in certain rural areas, they have obsessity. In other words, they do not have proper resources to cure things such as heart disease, cancer, strokes, and they also don't have the ability to take precautions to avoid them, and they also don't have access to healthy and affordable food due to being restricted. The consequences of this are more diseases. Many people are getting sick, and a lot of people are dying due to hunger and etc. And overall, the audience we want to target to receive this intervention would be all individuals living in the rural areas or going through obsessity.
Hello, my name is Amani Shaw, and I'm Group 1. I did the statistics. So the question was to discuss the health behavior significance to public health. We used a few quotes. Its prevalence remains significantly higher among adults residing in rural counties, 34.2%, compared to those living in urban counties, 28.7%, with over 1/3 of the American population. It has been estimated that the prevalence of obesity is approximately 6.2 times higher than in urban America. Income levels are generally lower in rural areas with jobs primarily in low-paid assembly work. These conditions all play a factor into the significance of the health behavior on public health. These conditions often result in struggling communities who have to spend most of their time working rather than being able to spend time working on a healthy lifestyle.
Hello, my name is Ashley Garcia, and this is Case Study Group 1. And for the first slide, I will be talking about diagnosing the problem. So first, we had to look at the quality of life. Now, the quality of life in Case 1 showed that they were living in a rural area, which means they didn't have the access to as many employment opportunities. School education wasn't promoting as much nutrition and physical activity. So in the quality of life, they weren't able to have as much exposure to what other people, like other communities, are living through, learning about nutrition, learning on how to be physically active. And these type of communities aren't as exposed to that. So that's the quality of life. When looking at the predisposing, reinforcing, and enabling constructs, we can see that for the predisposing, we have to become more aware of the importance of health, nutrition, and regular physical activity, and influencing their attitudes towards it. When reinforcing it, we have to look at the social support needed from family and friends to want to live a healthier lifestyle and want to become more physically active. And the enabling constructs, we can see that since they are living in a rural area, they need to improve the access of affordable nutritious options, and they just also need the environmental support as well. Now, when looking at the determinants, we can see that there is a socioeconomic determinant, which shows that the income and employment is very low, which means the people living in rural areas have to come up with a way to afford food, and affordable food in these areas are fast food, which does increase the chances of obesity, diabetes, and heart disease. And also the policy determinants are also there, since schools are not enforcing as much physical activity and not showing the effects of nutritional values as well. When looking at the demographic issue, we can see that, again, socioeconomic factors play a part, since there's less jobs, which means less income, which also means that they have to resolve to eating fast food. Environmental influences is that there are more fast food restaurants in these areas than farmers markets. There's less jobs for people to gain money and live a healthier lifestyle, and the community is just not engaging with one another to live a healthier lifestyle. Now, usually in rural areas, the culture and religion in these areas are more Christianity based. That's what we found. That's what we concluded in this. And the cognitive factors is that they have to live paycheck by paycheck where they live in, so which increases the concern of how they will support their family, which leads to nutrition just being their last resort in their lives. Now, when looking at the ecological model, so the ecological model is built up of like the individual, interpersonal relationships, institutions and organizations, the community, and the structure and system. Now, when looking at the individual, we can see that maybe the education is not being provided to the individual, or they're just simply not motivated to become more physically active or eating healthier, and they may be living in a family that sorry about this, but their family history may be affected to obesity as well, which now we will go into the interpersonal relationships. So family members may not be encouraging them to eat healthier. Instead, they're discouraging them, and not having that support from family can be a very detrimental effect to their health. When looking at the institution and organizations, schools may not be providing important insight about their health. They're not demonstrating the detrimental effects of obesity, eating too much fast food, not being physically active. Like, they're not showing students on how to be more physically active, not showing them how to eat more healthier, and that might be the downfall to them not having that nutritional value in their life. Also, with the community, now looking at the community, there is limited access to healthy foods such as farmers markets and grocery stores in these areas, which makes the downfall to becoming more physically active, which not being more nutritional in their lives, and that is just a huge downfall for them. We can also see that there are more options to fast food restaurants, which makes the community just not want to be physically active, not want to promote nutritional values. So we gotta look at that as well. And then finally, the structures and the systems. So overall, like, there's not enough policies to promote the healthier lifestyles, or they aren't decreasing the amount of fast food chains, and also there aren't as many employment opportunities to help them live a healthier lifestyle. Now, my final slide that I worked on was the program development. Now, the two-pronged prevention strategy that I looked at was, for the first one, was school-based interventions. Now, we do have to create a school policy engaging students to learn and adapt the ways towards being physically active and wanting to learn how to live a healthier lifestyle. And also, another thing that I was also researching is that if they funded more school nurses, that would help promote health and wellness towards their students as well. Now, for the prong 2, I looked at community-based interventions. Now, here we look at how to spread awareness towards the people in the community, such as social marketing and advertisement, and also some I'm just trying to think of the word. Some workshops. There you go. Sorry about that. Workshops. Trying to make more workshops for the people to want to learn how to be healthier, want to learn how to cook a nutritious food for their family, and also looking at ways to on how to help that nutritional value just be part of their life. And if a community starts learning and adapting this way, everyone around them will just start being more prone to it, which will honestly just increase the amount of nutritional value in their life and the amount of physical activity that they are just all bringing together. So now the two different theories / models that I thought would help change this health behavior is the theory of planned and health, the theory of planned behavior and the health belief model. Now, theory of planned behavior mainly looks at the attitudes within a person, which demonstrates how they could be influenced to change their behavior. And with the health belief model, it acknowledges a person's background, how much they know of a certain issue, and knowing that, they gain more information, which will help change their action. And finally, for the constructs that are most important to our program, first one off the bat is health education. Increasing the health education within the students and kids, they're going to want to be more healthier. They're going to want to become more physically active. And them wanting to do that is just going to increase the likeliness of their family wanting to do it as well. And also, finally, social support. That's another important construct that we need, because if one person in the family wants to do something, they need someone to help them come through with that, such as let's say a student learning on how to be more physically active, such as playing a sport. Then that student goes to their house and they're like, hey dad, hey mom, let's play sport, let's go to the park, let's be more physically active. And now that student needs the support from their family, needs the support from their parents. And by doing that, parents must join workshops or be more advertised to the benefits of being more physically active in their life. And that will honestly just bring everything together. Thank you.
Hi, my name is Sofia Magana, and a prevention strategy we decided to use to combat this problem is to provide healthier food options in public environments such as work organizations, schools, and public buildings. Adding more walking and bike paths as well as recreational facilities will also aid in combating high obesity rates. Adding words of affirmation within the packaging of these healthy meals and alongside the bike paths and recreational centers will also be a part of our program. The idea behind promoting a healthier lifestyle is to influence the public to make more health-conscious choices on their own. The goal of our program is to guide the public to make this healthy behavior change, not force them. The theory of planned behavior is a commonly utilized intrapersonal theory that is used to predict behavioral intention and behavior. TBP is an extension of the theory of reasoned action, which assumes that behaviors examined in this model are under total voluntary control. The idea is to promote a healthier lifestyle to change the norms of the public and their previous ideas on healthy habits. The theory of planned behavior and the theory of reasoned action both comply with one another and stand by the ideas of attitude, subjective norms, and predictor of behavioral control. That is why our prevention program is conditioning the public to develop healthier choices. By filling grocery stores, school lunches, vending machines, and any public food service with healthy food options that are free will allow for people of all backgrounds to make healthier choices. Adding more recreation centers, walk and bicycle paths, and free physical activities is also a part of the idea. The idea of this is to influence the public to want to make these decisions themselves and train them to make this their norm. Evidence for the predictive utility of the theories was found. The theory of planned behavior is a more promising framework for the study of exercise because it includes beliefs about control of factors that would facilitate or inhibit carrying out exercise. Providing free and accessible physical activities allows for people to feel in control of their exercising habits. This is why our program will be focusing on planting the intention of wanting to live a healthier lifestyle by providing free, low-cost, healthy meals, physical activities, and words of encouragement alongside. We want to make sure that our program plants the seed in the minds of the public to encourage taking up a healthier lifestyle.
Hi, my name is Alana Smith, and I'll be going over the recommendations. So, obesity is a significant public health concern that is being addressed by a number of current and proposed health initiatives. So, these regulations can be broadly divided into about two groups: preventative regulations and treatment regulations. So, for preventative regulations, we can start by addressing its underlying causes, including inadequate nutrition and sedentary lifestyle, and environment factors. Also, preventative programs that seek to lower the prevalence of obesity. So one important preventative measure would be dietary guidelines for Americans. These recommendations for a healthy diet are supported by research and include eating a variety of nutrient-dense foods, cutting back on added sugars, saturated fats, and sodium, and also increasing physical exercise. So for treatment regulations, the goal of treatment regulations is to reduce obesity in those who are already overweight or obese. So for these regulations, it can frequently include an emphasis on encouraging healthy habits such as enhancing diet and increasing physical activity, as well as facilitating access to mental health and physical health care. An important treatment guideline is medical coverage for obesity, screening, and counseling. So Medicare provides a coverage for obesity screening and counseling for eligible beneficiaries, including advice on healthy eating and physical activity. So to continue on, obesity is a complex disorder with substantial public health implications, so research into this topic is really essential. Obesity is linked to a variety of illnesses such as diabetes, heart disease, stroke, and some types of cancer, which can raise healthcare expenses and lower quality of life. So because of this, it is essential for enhancing public health to help us understand the underlying cause of obesity and identify efficient preventative and treatment methods. So there are several areas where further research is needed to address obesity effectively. Some of the most significant ones that I guess stood out to me that I feel like require additional study would, one, be understanding the role of genetics. So while environmental factors such as diet and physical activity are known to contribute to obesity, genetics also play a very big role. There's still a need to better understand and grasp the genetics of obesity, including the specific genes and pathways involved and how they interact with the environmental factors. Another one would be finding successful therapies. So there are various therapies targeted at preventing and treating obesity, but I guess many of them have mixed results. It is important for us to find better ways to support healthy habits, including increasing physical activities and improving eating, as well as to deliver efficient medical and mental health treatments. So in conclusion, more study is definitely necessary to combat the obesity pandemic and enhance public health. So if we understand these genetics of obesity and finding successful therapies, we can, create better methods for preventing and treating obesity and encourage and enhancing general health outcomes by tackling these problems.